Administration Advisory Council meeting. I am Megan Shelton, Director of Strategy, Planning, and Engagement, and am your BHA lead here and available to answer all of your BHA questions. And we have Caitlin Long here, who is our Boards and Commissions Coordinator. And I will pass it to Caitlin to go over some meeting logistics. And then also want to let you all know for today's meeting, unfortunately, our chair, Raquel Garcia, is out sick today. But we are very appreciative of our co-chair, Tasha Kankar, who has graciously agreed to take on chairing the meeting today. So we appreciate your patience, and we know that Tasha will do an amazing job. So with that, I will pass it over to you, Caitlin.
Thank you, Megan. Good morning, everybody. So good to see you all today on this chilly Thursday morning. So I'm going to go ahead and drop in the chat our pre-meeting packet that we reviewed last month, and every guest who signed up via the BHA website, specifically our BHA calendar, you should have gotten a copy of this in that registration link. But I'm going to go ahead and share my screen, and we will get started for the day.
Good morning, council members.
All right, everybody. Specifically, we wanted to focus here on our ASL interpretation and our closed captioning. So for ASL interpretation, we're having a little bit of difficulty about this morning. So I'm going to continue to try and pin our ASL interpreters. So please just kind of stick with us as we're working through all of this techness today. But if we can get it back up and running, during today's event, your participants' view will follow the view of the BHA panelist. ASL interpreters will be available to you during the event. Hover your mouse over the interpretation icon at the bottom of your screen and select American Sign Language if you wish to view this channel. You may adjust the ratio of your screen being shared by hovering the mouse to the left of the panelist until your mouse changes to a horizontal arrow. Click and drag your mouse across the screen until you have reached your desired view. For closed captioning has been enabled for this event. Click on the closed captioning button at the bottom of your Zoom window to turn on subtitles. If you need to change the subtitle language, click the caret to the right of the button and select your desired subtitled language. Remember, if you need assistance, please send a message in the Zoom Q&A. For the rest of it, please take a second just to review some of the group agreements as well as council member code of conduct. We ask both council members and members of the public to abide by these rules as we facilitate the meeting today. And then if you need some additional resources, they are hyperlinked here at the bottom of your screen. And with that, I'm going to pass it over to our chairwoman of the day, Tasha.
Good morning, everybody. Welcome to this month, February's meeting. It's February, yeah. February's meeting of our Behavioral Health Administration Advisory Council. So welcome, guys. Great to see you all. So I'm going to start out with roll call. So Karen Renee Anderson.
Hold the audio down.
I'm here.
Danielle Ngotti. I see that she's here. Dr. Rob Archuleta. Preston Berry. Whitney Young, or Whitney Butcher, sorry. I apologize.
It's okay, I'm present.
All right. Ash Castro's not here, Raquel. Carolyn Hall.
Oh, I'm here.
Oh, okay. Oh, thank you. I didn't even see you. Carolyn's here. And Natasha Conker, I'm present. Judge Elizabeth Leith.
Here.
Maria Martinez.
Here.
Keith Parker.
Here.
Antonio, I don't want to butcher your last name, so Antonio, and if you could let me know. Pito?
Yeah.
All right. Nor Shafee. Jamie Ulrich. Cameron Vijo,
Present.
Catherine Washington,
Present.
Seth Watkins,
Watkins.
and say, I, bleh. Say what? Can you help me with that?
GFY 24-25.
Can you help me with that, Caitlin? Sorry.
Vice Chairman Sullivan Whitestone.
Sorry about that. Thank you, guys. Can I get a motion to start meeting?
What'd you say? Motion to start meeting?
Motion to start. And can I get a second?
I'll second it. Oh,
All right, so that's confirmed. We are starting our meeting. All right. I'm trying to think of where I gotta pull the agenda. Sorry, I'm working off of so many things. All right. I'm drawing a blank, Caitlin. I'm sorry, guys.
You're fine. You're fine, Tasha. So we're just going to move on to the agenda overview. So for today, we're just going to review the agenda and see if we need to add anything to the agenda, and then if we can make the motions to approve the agenda.
So, can I get a motion to approve the January's meeting minutes?
Good morning. I make a motion to approve January's meeting minutes.
Can I get a second?
I second it.
Thank you. So with that, our January's meeting minutes are approved. Yay! Where's my glass? There we go. So approved. So now we go into council debrief. So our council debrief is we're gonna go council review with the community engagement presentation from January. If I'm asking you guys if is there any thoughts from the presentation, any pending questions that you guys may have, any clarification that anybody needs at this time or anytime? Oh, we're quiet today, guys. All right. I do know that there was some questions regarding data from last meeting that was asked by a member that wasn't here, as well as I had asked. So I just want to put that on the radar to maybe circle back to get the answers out that were asked for the questions that were asked last meeting. So I don't know. Yeah.
One thing I was just hoping for is when each of the community engagement specialists are in their respective regions,
Mhm.
Especially for in-person or any virtual events, can we just be notified so we could help get the word out or even attend one? I was hoping for maybe like a social media toolkit or email outreach toolkit so we could share it with our community. And maybe it could be a running document that we could just pull from and they could easily update every time they're in the community. I know it's a lot because that's their job, but especially if it's, bigger events, we can help with outreach and recruitment.
Fabulous. Thank you for bringing that up. I greatly appreciate your input on that. And I think that's a fabulous idea. I think Megan can answer for that. Megan?
Thank you, Cameron. So a couple of things. I didn't want to go past your question, Tasha, on data. Yes, we are working on a dashboard with a consultant company we've been working with. And so we're very close to having that ready to go live and be up, which will have all kinds of different data components of where the engagement is taking place, what we're hearing from communities, who's coming, lots of different things that we're collecting when we do those surveys at the end to get that information. And so we'll have a live dashboard that will be really exciting, a really useful tool of transparent engagement throughout the community, what topics are being discussed and what communities are being engaged with. And then to move on to your question, Cameron, we are also working on developing a calendar of events that will also be able to be on a live page where there will be for each community where they will be within those communities and thank you for bringing that up. That's definitely something we want to make sure that we're really working with our councils to get the information out. You all are really such a strong connection for us within the communities. So to make sure that people know how to connect with their engagement specialists and where to connect with them. Tasha, you are on mute, but it looks like you're talking.
Oh, that mute button. Thank you, Megan. That was for that information. That was very helpful. I did miss something about the meeting cadence with our so I'm going to just backtrack a little bit. Our council's code of conduct and our meeting cadence, right? Is that correct, Caitlin? Am I wording that correctly? About the code of conduct, the code of conduct.
What about for it, Tasha?
I was just bringing it up, like, to review the code of conduct for the meeting and the cadence on how, if you could review that right quick, I would appreciate it.
Meeting packet that I dropped into the chat at the beginning that we reviewed the ASL interpretation and closed captioning.
Okay.
I'll go ahead and drop it again if anybody would like to review that again. But the code of conduct and some of the additional resource links and stuff like that are in that pre-meeting packet. So everybody who registered via the BHA public website should have received a copy upon registration. And then it's in the chat a couple of times. So if you need to review that, please feel free to do so. But thanks for flagging that again, Tasha.
Thank you. I appreciate your help on that. So are there any other questions, any thoughts, concerns to do with community engagement from anybody? All right. So let's see where we at on attendance 10.
Tasha, I can just add that anyone is welcome to reach out to me. And I can also put the link in the chat again for anyone that needs to know who their engagement specialist is. We do have a document that we share out that will say a little bit about each engagement specialist for each region. So if folks want to make sure that they can connect with those folks, please reach out. If you have any struggle with that, please reach out to me directly and I will help you navigate that.
Thank you. Thank you. I'm trying to watch time and make sure I don't blow through this so fast and talk so fast. Oh, my ums. So 9:35, we're like 20. Anything else we need to cover since we still got time? Like, we're ahead of schedule.
Yeah, if I may, Tasha, just, really spending some time wanting to kind of debrief with you all about our previous presentation. So, what we have kind of seen and heard from the council as a whole is that, there's a lot of information in flux in these meetings, but you all hadn't really felt like you've had the time to have some conversations about, what we've been learning about and things like that. And so we really wanted to kind of create this space for you all to be able to have some of these conversations and just think about, what was discussed at that last presentation. Did you have any other questions about the presentation? Is there some clarification that might be needed, or some suggestions that you might have? It's exactly what Cameron had kind of made that suggestion about regional notifications and things like that. So really just, wanting to hold this space for you all today. So if you don't have any, thoughts or comments or anything, we obviously won't pressure you to say anything, but really, really trying to work with you all and to hold that space for this discussion and debrief section. Would it be helpful if I kind of share the slide deck from the community engagement presentation again for you all to review and maybe, if any questions kind of pop up from there?
I think that would be a great idea, Caitlin, so we can look over that and just refresh our memories from what we went over last month.
Absolutely.
Thank you.
Can everybody still see my screen okay? Okay. So coming down to our community engagement effort, talking about, the number of community meetings and listening sessions that the commissioner had, some of the emerging themes that came out of these conversations. Looking at some of our emerging themes here from system navigation, prevention, transportation, coordination, housing, jail-based services. Some upcoming action items. So are there any questions about our upcoming items? Because we definitely have a lot of them coming up.
I do have a question here. When it comes to the jail-based services, just wondering how that's being included, like how that's being incorporated, or what the vision of that is being incorporated within our children and youth detention centers, as well as our adult jail-based services, and how community engagement specialists are doing that. I don't know if that's where we're at now, but that's just something that popped up. So that's one of my questions.
Can you say that first part one more time again, Tasha? You cut out for me for a second.
Okay. I was just curious to know, I'm wondering to know how community engagement specialists are engaging in our detention centers for children and youth as well as adults. And maybe that's something for Kelly Fossey in later on in the agenda that she can answer. But for jail-based services and stuff like that, I'm just curious to see how our community engagement specialists and everything is incorporating that to meet the needs of all.
Tasha, that's a great question. I'm going to ping Matt, and I think we can talk about that now since you're
Okay.
asking about it.
Okay.
And so I'll focus just a bit though, have Matt talk just to your point about the jail-based services in connection with the youth plan and what we're doing. And then Megan can speak to the community engagement folks on their intersections and what we're doing in community. But Matt, can you comment on that, please?
Yeah, and that's a great question. I love the insight, Tasha, on it, because we do know that a lot of our children and youth, especially, right, are receiving services within the Division of Youth Corrections or Youth Services now. And so one of the things that we would like to do actually at BHA is expand into that area more so than we have been in the past. We do know DYS does provide an absolute ton of behavioral health services and mental health services to their youth in those corrections, but I don't know what they are, right? Like I said, I know they do a lot of assessment and I know they do a lot of therapy, and we do have some folks from DYS who we do meet with regularly. I think it really is a point of focus for us, especially in the next 6 months, to make sure that we do have a closer connection on what those services actually are, and then seeing the outcomes, right, from those services. So your point is not lost. It is not something, right, that we're just bringing up now, and it's going to take a lot of work, I think, on both of our efforts to do that. So that's just the piece on the children and youth for sure. But I think it's a great point and very important for our kiddos.
Thank you, Matt, for that. What about with jail-based services, like adult jail-based services? Like, is that pretty much where it's at with the child and youth? Like, is it all together?
Yeah, I can't speak too much to our jail-based services, but for adults, especially with the focus on youth that I definitely have here. So I'd have to default to somebody else. Sorry about that, Tasha.
Yeah, and
no worries.
Tasha, it's a great, I'll say though that it is separate in the sense that our jail-based services and that team, and happy to have them share information, even if it's written instead of just verbal or something in a meeting. But for the jail-based services, we have a team that focuses solely on that and on the adult side. And then as Matt shared, we're boosting that in terms of representation and input and coordination and all of that for the children's work also.
Thank you so much for that information. Yeah, that was great. Thank you guys so much. And Judge Leith.
So who is in charge of the adult jail-based services?
Great question.
Yeah, thanks for asking. Yeah, sorry, Megan, do you want me to? Mark Condojani is the division director for our adult care continuum, and the jail-based services or criminal justice work on the adult side comes under him. And Danielle Culp is the person that also then supports that team and leads that group within Mark's division. And Judge Leith, I know our team has been meeting with you, and you know Mark that well. So
You know,
yeah.
Mark, it's just really hard to sort it all out as to who does what and who we're supposed to go to and ask questions of.
Yep, I appreciate that, Judge. And I would say that Mark or myself, and certainly Commissioner would say she is always that person for you, but you can definitely reach out to Mark and me at any time, and we can make sure you get what you need and that we can connect you to the right person.
Okay, thank you.
You bet.
You're on mute, Tasha.
That darn mute button. In the chat, it did say Rachel Simpson said that she could answer that within a week. Or would you like to speak of that, Rachel? Could she come off of mute? Or is she able to? I don't know. Okay, she can't come off of mute, so.
She can. I just
Okay.
allowed her to speak.
Thank
So
you.
Rachel
Thank you.
should be able to talk to that now.
Thank
Welcome.
you.
You're welcome.
Thanks. So just from my little corner of the world as one of the regional engagement specialists, we have kind of prioritized, our priority populations. And just within the last week or so, criminal justice involved individuals became one of my focus areas. So I'm going to be learning as much as I can about the topic and the community, and then reporting up to the rest of the team. And my kind of focus will be it won't be limited just to my region. I'm going to be learning as much as I can about criminal justice involved individuals throughout the whole state. And then just my little regional area of the world. I'm just, kind of the local specialist on just all topics, broad topically. But anyway, I hope that helps.
Very, very well. All the information that we got. Thank you so much for providing all the information that everybody provided into this question. This is also helps with the people of Colorado too, so they can know how to learn how to manage, like have the resources. So thank you guys so much.
Sure.
I appreciate that.
And please, you all are the subject matter experts and I am learning. So please keep me looped in, contact me often, and let's meet up when possible physically.
Absolutely. And we're all learning here. So that's what's the great part about that. I saw Danielle's hand up earlier. I didn't know if your question got answered that you were wanting to ask. So I'm just giving you that space right now since I saw that.
I was just asking if we could possibly blow up the PowerPoint so that I could read it a little more because it shows very small on the screen. And I was really interested trying to read those slides as they were rolling by quickly.
Okay, thank you.
Thank you, Tasha.
Yeah, not a problem.
Tosh, I have a question.
Yes, Keith.
These engagement specialists, where are they located? I mean, where are they in the regions? Because I've never heard or dealt with a community specialist since I guess they've been around. So where do they engage at, since they their main priority is the community. So my question is, I don't see them in the community.
Thank you for bringing that up, Keith. And our goal is for them to be the voice of the community back to BHA. And so these are fairly new positions, Keith. They just started last fall with us. And so they are fiercely building out their networks. They are involved with all BHA community engagement. They're on all of our our virtual events, our in-person events that are BHA wide. They help support all of the big initiatives that we're doing community engagement with. And so if you join any of the listening sessions that we've had, the listening sessions on the Child and Youth Behavioral Health Implementation Plan, or on the safety net, on the community engagement conversations that were throughout the state with Commissioner Smith last fall. They've been in all of those, and they are working to build out their networks. Keith, can you remind me are you in the Denver area?
I'm in Aurora.
Perfect. I will connect you with Brittany, who is the engagement specialist for your area. I think you would be a great connection for her, and you can help her get connected into the communities that you're familiar with and in your network. So they're all working on building out their frameworks on how they engage with all underserved populations within each of their regions. And so they live in the communities that they represent. Unfortunately, we do only have 4 of them. So their regions are very large, but they travel throughout those regions to engage with community members. And so as they're working on that and focusing on all priority populations within their regions, what you heard from Rachel a few minutes ago is within our team, we are also working on ensuring that we have a very streamlined approach for how we're engaging with all priority populations statewide and how we're collecting all of the information into one place. And so amongst those 4 regional engagement specialists, they have divided up each of the statutorily called out underserved populations, and they've each been assigned to take the lead on that. And so, for example, Rachel was talking about criminal justice. She will be collecting everything that's happening within the behavioral health world of criminal justice, building out that network statewide so that we can be able to articulate that back and have it all in one place. Does that help
Right.
answer the question?
Yes. Now, what was her name? Brittany? What was
Brittany,
his
I
name?
will
Can
I'll
you
put her email in the chat for you.
Thank you. I just want to do time check. We have 5 more minutes before this, and Karen Renee Anderson has her hand up. So I just want to do a time check right quick. Karen, yeah.
Okay, so I just have a question, and I've asked this before at a different meeting, and I was a little bit confused, as I still am. So we have 4 of the community engagement people, or whatever their title is called. Why are they not aligned with the BOSSOs? Why do they overlap? I don't understand that.
So, Karen, they will be working with the BOSSOs. So there will be an alignment with the BOSSOs. The specific cannot speak this morning. The specific reason that the regions are not the same as the BOSSOs, if you look at the BOSSO map, one of the BOSSO regions is over half the state. And it would not be feasible to ask someone to travel over half the state and have that be their entire region. So it's just the geographical piece. 2 of the regions are very small and kind of urbanly centrally located within the state. And then another one is more the kind of the eastern side. The way that we designed the regional engagement specialist regions was really based on geographical and travel throughout Colorado. So ensuring that we would have someone living in each of these regions that can easily travel throughout, and that doesn't become a barrier for them. So with that being said, they will each be engaged with all BOSSO regions that are all BOSSOs that intersect with their regions. So you will have multiple regional engagement specialists connecting with each BOSSO.
Okay, I still don't understand the logic of that, because members have to, anyone that, is going to have, because of the way that the BOSSOs have been broken up, which is great. I'm not, saying the regions are wrong, but we all have to travel a far place. Like if where I live, if I need to go to the hub was probably in Fort Collins, which is a day's drive. And so to me, it's like, it logically doesn't make sense to me to have them not aligned completely, because wasn't that the reason we had the regions and individuals, so that we can all focus together as a team? But when they're overlapping, it's like weird to me. I don't know if I'm making sense, but it just doesn't make sense to me why they're not aligned. Yes, I realize that there's two regions that are huge, you know, Wyoming to New Mexico, Utah, and Kansas. I mean, it covers all those borders, and there's two urban areas, which I get that. But to me, it would make more sense that one regional person per BASO, so that you had that team going rather than adding more people to that. Just my thoughts.
Yeah, and I think having multiple regional engagement specialists at each BASO actually helps to bring the community voice and coordinate with BHA. So I think having more than one working with each BASO is actually a helpful thing, because the regions are so large, and it does ensure that we have representatives throughout the state that are able to help bring the voices of the community into the work.
Okay. So the other question I have then is, so if I'm needing to get a hold of someone, how would I know, except unless I knew the actual where their territory was, rather than saying I need to get a hold of my regional person in my BASO? When if there's more than one, doesn't that add more confusion to the member themselves?
And Megan, may I jump in for just a second? Karen, you're raising really good questions. I think a good distinction would be that the way people will connect to BASOs isn't through our community engagement person. So there'll be access to BASOs and the network on their own and how that works. And we have these regional community-based engagement specialists that are one more way that folks can, from community, bridge to BHA and have that access point. And there'll be regional boards connected to BASOs too, representing folks from those particular regions, also informing BASOs. And we'll also have you all as BHAAC members, our staff out in community. So this is a way, the community engagement specialists are just one more way in which we hope to build better bridges between community and BHA and really good input and feedback loops, but it's not the only way. So this is just one more way in which we're trying to make sure we have folks out in community, living around the state, not just in Denver where our offices are, who can help to inform and connect people and hear from folks and be in community and make sure that we're as accessible as we can be.
Thank you so much for that, Kelly. All right, we are 1 minute over to move on to our next agenda, and I hate to do that, like, because this is such an important conversation that everybody that everybody wants to know about. So, but I hate to do that, but because of agenda, we have to move on. So we're going into council administration reviews. So commissioner updates, like a monthly one pager is going to be coming out in March. Commissioner to attend meetings quarterly. So Caitlin, or Megan, you guys have anything you can add on to that?
Thanks, Tasha. Yeah, so I am working with the commissioner's right-hand person to start creating some monthly one-pagers that is going to be able to answer some like high-level questions from you all. It's going to provide some updates with regards to, what's going on with BHA, what's going on with leadership, what's going on within the state in general. We did have a question from Carolyn Hall for our first March monthly one pager that's coming out, and the commissioner is going to be specifically answering Carolyn's question regarding peer specialist role, how the commissioner envisions peer specialist role within 988 as it continues to move forward. So the commissioner is going to be able to answer that in the monthly one pagers. So this is going to be kind of like another avenue for our council members to be able to get some questions answered by the commissioner. So if you have any questions for the commissioner that you would like to be answered, please don't hesitate to reach out to myself or Megan Shelton so we can incorporate that into the monthly one-pagers moving forward. But the first monthly one-pager will be coming out in March. It will be included in the agenda email that you all receive the week before the council meeting. So you'll all be able to kind of review that ahead of time. And then the commissioner is going to start attending meetings quarterly instead of the couple minutes at every single meeting, since we have moved these to a monthly meeting cadence instead of a bi-monthly meeting cadence. So just kind of keep an eye out on your email. That's going to be coming down the pipeline, but it's just going to be, another resource for you all to utilize with regards to, kind of learning what's going on within leadership, BHA, and some of those high executive level information that we're all kind of looking to get. Any questions about that for me before I hand it back over to Tasha? All right, passing it back to you, Tasha.
All right, thank you so very much. So guess what, guys? Recruitment time. Woohoo! Woo woo. Bittersweet a little bit. Our inaugural council is coming to its first term, and so we're coming up on starting that time to recruit. I'm gonna ask you members, like, do you have any like suggestions on who we should reach out to, like organizations, community members, etc., stuff like that, when it comes to the recruitment. Caitlin, what all positions are we recruiting for this new term that's coming up? And hold on, I want, before you answer that, all council members that are interested in applying for another term, you're more than welcome to do that. Caitlin has more information on that, but yes, I encourage you guys, I encourage council members to reapply that are terming off in June.
Yes. So exactly as Tasha said, so our inaugural council, if you can believe it or not, your terms are ending in June 30th. So it's already been 3 years, which is crazy. But we council members are eligible for a second 3-year term if they would like. We do ask that all council members who are seeking that second term to go ahead and reapply via the BHA website or the application that is hyperlinked here in the agenda. Also for members of the public, if you'd like to apply for the council, we are accepting applications beginning in March. And so you can find that application via the BHAAC public facing website. Judge Leith, no, the ones who have just joined, you still have many years left, so you're good to go there. It's the inaugural council members who began 3 years ago that their terms are ending. So it's just for, some of the OGs that we have here, like Tasha, that we would ask for them to reapply for that second term to get the commissioner's approval. The seats that we are going to be recruiting for specifically, give me 1 second and I will pull that.
Are gonna be, I can jump in and answer that. That's gonna be a persons that represents a disability, persons of disability, as well as, I believe, safety net.
Yes, the behavioral health safety net provider and persons with disabilities as defined by CRS 2434-301. So those are 2 seats that we're going to be specifically recruiting for. However, any member of the public is welcome to apply at this time. And we're just kind of getting our recruitment process up and running. So exactly what Tasha had mentioned, we're just kind of asking for some information for you all, with regards to who we're trying to recruit and including, that lens of diversity and everything like that. We're really trying to be specific with who we're reaching out to within our communities to get some applications from. So if there's any, organization that you all recommend or any community member that you all recommend or a newsletter that we could tap into as we're trying to actively recruit for this council, we'd love to get some feedback from you all regarding that so we can really, make sure that we're being specific with our recruitment effort.
Right. Just to let you guys know that we are 2 minutes over from our break time. I see Carolyn's hand up. I don't know whether we should take that or go to break because I don't know if our next presentation, Ryan Templeton and Kelly Clossy, if they're on time restrictions with their meetings. So, any input for that?
Carolyn, can your question get answered after we come back from break?
Thank you, Carolyn. I didn't mean to do that to you.
No, that's okay. That's okay.
All right. So our meeting time, we're 3 minutes over. Is it okay if we do the 5-minute meeting? Go 5 minutes. Is everybody cool with that?
Sounds good. So we'll come
All
back
right.
at 9:48.
Yep. See you guys at 9:48. Fill up on your waters and yeah, stretch. Question for you, Caitlin, right quick. Is there by any chance that we can get a recap of like shortly after this of everything that was said, like chat, because I don't want to miss anything of any questions in chat that were missed or in the Q&A.
I will definitely upload a copy of the chat transcript once it's finished processing after the meeting to the BHAAC Google Drive.
Okay, thank you. I greatly appreciate that.
Absolutely, and I'm trying to answer the Q&A questions as they come up, so we're getting those done at least.
Yeah. Thank you. Just want to let everybody know, time check, 2 minutes, 2 minutes and counting. One minute and counting. It's that time, 9:48. If y'all can mosey on back to cameras and let's get this started. We got business to do. Thank you, guys. Just double checking to make sure everybody is back from break. So we can move on.
Good.
All right. All right. This is my favorite one to introduce. We're moving into, let me pull up my document. We're moving into presentations. My favorite, Ryan Templeton with budget and legislative updates. I'm gonna hand it over to you, Ryan.
Thank you, Tasha. Ryan Templeton, Legislative and Governmental Affairs Division Director of the Behavioral Health Administration. I jumped on and I think, Carolyn, was there going to be a question that was asked after? I just want to make sure that I'm not getting in the way of.
No, it's okay. I just wanted to say I applied, but I could answer more than one of the reasons why or why I wanted to be on there, but it's okay. I'm not worried about it, but thank you.
Okay, so some of the recruiting stuff that I'm assuming Caitlin and Megan can help you answer specifically as well. So.
Okay, thank you.
Yes, Carolyn, definitely don't hesitate to reach out if you have any specific questions around it.
Awesome. So with that, Ryan Templeton, Legislative and Governmental Affairs Division Director with the Behavioral Health Administration. Not that anyone's counting, but today is day 44 of 120 of our legislative session for 2025, which started on January 8th and ends on May 7th. So once again, 44th day, we're over a third of the way done already with this session. Going to start with budget. It's a tough budget year. We've talked about that before, right? We're about $1 billion deficit that are trying to, JBC, the Joint Budget Committee, is trying to find that dollars, the money to make a balanced budget. It's constitutionally required for Colorado to every year have a balanced budget. So JBC is looking in all different sorts of places to find the money they need to make sure that we have a balanced budget in Colorado. So with that, the next thing for the Behavioral Health Administration is it's a thing called figure setting, which we are scheduled for March 3rd, which is a Monday. Sometimes they don't meet on Mondays, but it's going to be around March 3rd is when BHA's figure setting hearing happens at the Joint Budget Committee. What that essentially means is the JBC analyst, still the analyst that works for the Joint Budget Committee, presents on our budget requests and makes recommendations to JBC about where JBC should make decisions on what BHA's budget looks like. With that happens, and then after figure setting, after all of the departments go through the figure setting, there's an ability for departments as well as the JBC staff to come back and say, hey, reconsider this, or you made this decision, let's reconsider this because there's new information, or just hey, we don't like what they cut, or maybe do something different here. So that's called comebacks, which all sets up for the long bill package to be introduced in the Senate, scheduled for March 24th. So looking at your BHAAC next meeting is Thursday, March 20th. So it'll just be a few days before the long bill package. So we'll kind of have a little bit of an idea about what to expect within the long bill, but it's going to be an interesting update. I would assume there, maybe a little bit more interesting than this one, because things are kind of slow rolling because the budget, those things have to be decided so we know what bills can move forward. No bills with an appropriation, which means no bills that cost money are moving forward. Right? We have to get the budget right in order to know what type of money there is available for other types of bills or those special bills. In your agenda, there is that link to that's blue there, the legislative updates. That, if you remember, BHA creates a bill dossier. So this is the 2025 behavioral health bills. This is yours. This gets updated. I think it's about 4 or 5 in the morning, every morning with updates. You can see on there, there's client calendar notifications, there's summary of bills. There's about 30 behavioral health bills. Not all of these impact BHA directly, but these are ones that BHA is following because there's a behavioral health intersection. So with that, that's yours to do with what you please. There's also links embedded in there that includes the fiscal note and amendments and history. So could potentially be a great resource if you're interested in diving deeper into each piece of legislation that has been introduced so far related to behavioral health. I'm just going to highlight a couple of the bills. Senate Bill 42, which is the crisis response system recommendations. I think we've talked a little bit about that bill. This is coming from the behavioral health disorders in the criminal and juvenile justice system interim committee and the associated task force. So that bill passed through the Senate this week. So what it does, Department of Public Safety, they are to put together a virtual stakeholder group related to alternative responses. Think like co-responder programs or like EMS type programs, and really establish what are the existing resources and what are some model programs that other communities could adopt within their community, and also include where's reimbursement shortages and what are the gaps that are needed to fully fund programs like this. Again, this is a stakeholder group, so it's not saying, hey, this is how much money we specifically need to expand this, but we're seeing a lot of bills this year like that, right? Let's get together and talk about these things to come up with what does the system need. Department of Public Safety does that. BHA specifically, or us specifically, are to submit a report by January 1st of 2027 related to reimbursement shortages and gaps related to our crisis response system, right? Mobile crisis, walk-in centers, where are shortages, where are gaps, how do we reimburse providers appropriately to make sure that people have that access to the services they need in a crisis setting. This also includes treatment in place being those when EMS goes out, they have some EMS providers that have the ability to go to the individual in the community and not essentially throw them, or I shouldn't say throw them, put them in the back of an ambulance to get them to where they need to go, but have a real community-based response through EMS and the medical provider like that. So we at BHA will also be submitting that report, so be on the lookout for that. Last couple pieces there, healthcare policy and financing, the reimbursement for providing inpatient mental health treatment for up to 60 days. This is a big deal because right now it's only reimbursement for up to 15 days. So this is ensuring that there is the ability to providers to get paid for providing the inpatient services that people need for up to 60 days as part of the Medicaid benefit there, which is a huge deal for Colorado. And then the last one, just to round out this bill, there's some updates to the mental health hold process, which essentially is just a clarification that an individual should not be discharged off a hold unless they no longer meet the criteria for hold. That should be a process that is happening. And so we're saying that, yeah, this should be happening. Really, the only exception to that would be is if someone's transferring from, say, a hospital setting or an emergency department to a designated facility. Like it's a transfer, not a discharge from a hold, but it's just clarification, which is needed there. So that's Senate Bill 42. The other one I'm going to highlight is that late last night, House Bill 25-1132, which is the Military Family Behavioral Health Grant Program, passed through the House Health and Human Services Committee yesterday. So the reminder about this one, this is in November, right? The voters passed Proposition KK, which created a new tax on firearms, firearm parts, and ammunition. So within that, the voters voted on where that money goes, right? So this doesn't change the voters. The first $30 million of that tax goes to fund victim services, and then the next $5 million goes to the Behavioral Health Administration to expand mental health services programs. So what this bill does is does that, right? What are those programs? So there was a strike below amendment that happened yesterday, which means the whole bill was rewritten. So if you're looking at that bill, it would be the amendment part of the bill, which isn't quite updated on this bill dossier yet, but you'll see it in there eventually, likely later today, or if not, or first thing in the morning tomorrow, that essentially says that, hey, BASOs, we have a BASO structure, our behavioral health administrative service organizations that have the structure in place or will have the structure in place to issue those grant programs to communities to make sure that we have or continue to have veterans behavioral health services in alignment with what Prop KK and the voters agreed upon. With that, I know we're running close into time. I actually have to jump on to the Behavioral Health Disorders and the Criminal and Juvenile Justice System Committee here at 10 o'clock, but got a couple minutes if there's questions.
There is a question in the Q&A. Will this address TRICARE?
So TRICARE being let me actually pull up the question in a section. There's a connection back to TRICARE being the essentially the insurance for military personnel and veterans. So there is a connection there about what TRICARE pays for through the VA clinics. For instance, there is a connection there. Part of what we do is work directly with the Department of Military and Veteran Affairs within these programs to make sure that there is that connection there. So the state through this grant program isn't taking over what TRICARE should be paying for through Veterans Administration. There are some barriers to that, which we've heard about over the last few years about what does access look like through the VAs and whatnot. So work very closely within this program with the Department of Military and Veteran Affairs that works closely with the VA as well to make sure there isn't a duplication of costs and payment for that. So it's a connection, but doesn't supplant or conflict with TRICARE service delivery.
Thank you, Ryan. And I just want to give you a shout out. Thank you for like not talking so fast and getting excited. So I appreciate that. And yeah, so thank you for your communication or for your presentation today and informing us of all. Anything else, Ryan?
Yep, I see.
A hand up, Antonio.
I will. Yep.
Yeah, I wanted to ask about the HB 25-1008, the complementary behavioral services in jails. And I wanted to ask about like it requires, they're looking for annual appropriate up to $50,000 to train and all of, train the behavioral health specialists. Or the supplementary behavioral, that number seems like kind of low, and wanted to know where they came up with that number, and is that every jail, or are there going to be any further efforts to increase that amount, because that seems like a pretty low amount to be able to train staff to provide that supplementary services.
Fantastic question. So what that bill does is adds to the current appropriation for BHA's behavioral health or jail-based behavioral health services program. So it adds an additional $50,000, which is on top of the $16.7 million for that JBBS program, to do a additional thing within that program, which is the complementary services, which think of like acupuncture or massage therapy in the name of behavioral health within a jail setting. That's specifically what that $50,000 is for, that just adds to that larger appropriation that currently exists.
Thank you, Ryan, for that. And if you guys have any other follow-up questions, feel free to reach out to the BHA or us chairs, so we can make sure that if there's any additional questions. And there's also a link on the website, I believe, that we can do that as well. So on that note, I know there's a lot going on with children and youth services. So the children and youth. So I'm going to hand it over to Kelly Clossy and Matt Holtman, correct? Both of you guys?
Yes, we're here. And Dr. Lindsay Edwards joining us. Keith, I see your hand up though, and I want to make sure I'm being respectful before I jump right in and talk about kids.
Yeah, I just had a question for Ryan, and well, two questions actually. Is that okay? If we revisit that for a split second?
Yeah, if you want to just be mindful of time, if you wouldn't mind just like quickly asking at least one of them, or if you could email us the questions as well.
Well, the question basically was just is this information available in the chat or description of what he was talking about of these JBS programs? Ryan was talking
Um,
about that earlier.
Yeah, I will send over the talking points that I went through that includes JBBS links to where to find that information on BHA's website. So then it's an easier, even through the minutes that you all get for today's. So you have additional access points for what jail-based behavioral health service delivery looks like. Yes, we can make sure
Right.
that happens.
Okay. All right. That's fine. That's pretty much all I had. Thank you.
Thank you. Great question, Keith. And thank you, Ryan. I think that sending it out just to give a little bit more clarification so everybody understands. So thank you so much for the transparency on that. On that note, Kelly, take it away.
All right, I will do so. Thank you all for having us today. We sent you have the materials of the slides already available. I'm gonna move a bit quickly because I want to spend our time with Dr. Lindsay Edwards on one of the programmatic impacts that we're making. I wanted to share high level though, that if you have any questions about our children and youth work, things that we're not covering today, always feel free to email me and I'm happy to get you whatever information or set up a time to provide what you need. We had several listening sessions, community listening sessions for our children and youth plan. And as a reminder, the plan is really just one way in which we're trying to get to system reform. How can we build a care continuum for our kids that's better than what we've ever had before? The plan is one way in which we're doing that and reflects 12 different state departments and the Lieutenant Governor's office in our work to coordinate the state departments to help to get us there. It's not the only way, though, that we'll get to this system reform. So we had community listening sessions that we hosted, and I gave in the next slide, we provided for you all just some details on that to say that over 500 people from communities around the state participated in these listening sessions. We generated and asked the public, for participants, when you register, what's top of mind for you? What questions do you have? We had 550 unique questions. We're responding to all of those. We're going to have that on our landing page, and we're going to email folks who participated to say, we've responded, we've provided information. I'm sharing this with you to show that we're being very active in wanting to have community inform the work that we're doing, and for BHA to fulfill our commitment to also have a feedback loop. So you've given us this input, here's what we've been doing with it, and it'll also help drive our work. So we should have that packet of responses up on our landing page, probably within another month or so to do it. I think we're aiming for the end of March. And so we were very excited about the participation, had really good input from community. We shared a couple of other slides. One is just a depiction of the reform in progress. HICPOF has their system of care that they're building. CDHS has that. Within our jail-based services, we provide young people care. So this just helps it pick when we're talking in general about a care continuum or system of care, a very simplified depiction of just some of the common components, because we're often asked, how does CDHS, BHA, and HICPUF all work together with our system to provide care? And so again, if you're involved in this system, this is a very simplified version of it, I know, but just to provide a visual to help the public, and we use this in the listening sessions to help them understand how it all fits together. One other piece, and then I'll kick it to Lindsay, is that in the plan, there were 19 priorities for this past year and predominantly focused on youth with high acuity needs. Matt and I can go into much more detail about all of this. We just wanted to share with you the visual that the State Department's fulfilled these 19. We can go in more detail, but in terms of like a little report card for those of you who like it, we wanted to show that we made progress. In this year ahead, it's very much focused on early childhood and prevention. Department of Early Childhood, CDPHE, have their key priorities come up in this year, and the other departments continue to work on our ongoing work with this too. And so just to give you that high level overview. I'm now going to kick it off to Dr. Lindsay Edwards. She leads our CYMHTA. You got slides and information on this. It's making an incredible impact. It's a critical service that we're offering and approach. And I wanted to give Dr. Edwards a chance to be with all of you and share high level the work that we're doing. And so I'll kick it over to you.
Thank you, Kelly. Hi, everyone. I'm Dr. Lindsay Edwards. I'm so very glad to be with you all today and to share some of the wonderful progress that the program that I oversee is making. First, a little bit about the program, if you wouldn't mind to move the slide to the next. Thank you. So CYMHTA, as Kelly mentioned, is a critical component of BHA's continuum of care for Colorado's young people and their families who are in need of behavioral health services. CYMHTA at its core is a family preservation and reunification program. So it provides essential clinical services or funding for clinical services for young people who need behavioral health, but who can't otherwise afford the behavioral health because they either don't qualify for Medicaid or a CHIRP waiver, or they also can't afford CYMH, or they can't afford services out of pocket, and CYMHTA will fund in that circumstance. So it's really meant to be an alternative to child welfare involvement because of its history. There's been historically a gap in services where young people would be accessing the child welfare system in order to fund behavioral health services. And so CYMHTA, part of our policies require that a young person cannot be in a family where there's a current or a pending dependency and neglect action. Currently, we have about an $8 million budget for our program. And I've included a number of slides for your review on your end. The slides cover what types of services we offer. It covers our legislative history. It covers the core components of the program. I'll let you all review that on your end. What I'd like to do, if you don't mind, is to move to slide 12. And what I want to show you is some of the outcomes from our annual report for fiscal year 2024. This is the part that I'm so very excited about. You can see here that CYMHTA has had steady growth since its inception in the 90s. This program was started in the 90s. So this is just within the last 15-ish, 16 years, I think at this point. But what you'll see is that CYMHTA has had steady increase each year with only a few decreases in 2012, 2016, and most recently after the COVID bubble. Next slide, please. So our findings from the annual report for state fiscal year 2024 were very exciting. We were able to analyze some new data points this year and some old data points. So CYMHTA in the previous fiscal year has served 244 children and youth. That means that those children and youth received clinical services. We funded 201 clinical comprehensive biopsychosocial assessments, and we discharged 96 youth. Of the youth who were discharged in state fiscal year 2024, 75% of those youth were all found to have completed all of their clinical goals at discharge. That's a longstanding data point that we've tracked. The new data points that we have tracked this year are looking at involvement in the child welfare system after discharge. So we were able to take the list of young people that discharged from CYMHTA and cross-check it with information or data from the from OCYF, from the Office of Children, Youth, and Families, and look at, did our discharged youth have any contact with OCYF after their discharge from CYMHTA? And we found that 87% of our discharged youth had no involvement at all, no contact with OCYF after their discharge from our program. So we're taking that. This is the first data point, so we don't have year-over-year data on this, but we're taking that to mean we're seeing that as a success, that we have 87% of folks that haven't become involved. Part of the reason that's significant is that the criteria for coming into CYMHTA is the young person has to be at risk of out-of-home placement in order to be eligible for CYMHTA. That's why it's a really meaningful data point. The other new data point that we were able to analyze this year was looking at CANS data. So that Child Adolescent Needs and Strengths tool, we have both baseline and discharge data for all of our discharged youth. And we were able to see if there were any improvements from baseline to discharge. And we had 65% of our discharged youth who showed improvements from baseline to discharge on the life functioning domain. A point of information for interpreting this data is that our scale is from 0 to 45. And on average, the people who discharged, the young people that discharged from our program who showed improvements, they improved by 4.74 points. So on a scale from 0 to 45, that's almost 5 points. We're seeing that as quite notable. The other thing for interpreting these results to know is that the CANS has 4 response options that a young person can be marked with. A 0 is that there's just no need for intervention on a particular topic. 1 indicates that there is something to watch there for a young person, maybe not intervene yet. 2 is there is some action needed in order to help that young person. And 3 indicates that there's some immediate need for action. Something needs to happen right away. And so in order to get a 45 on that scale, a young person would have to be rated with 3s across the board, which just doesn't happen. What happens often is there'll be a couple of 0s and then a couple of 3s. And so for the folks that didn't improve from baseline to discharge, there are young people in that little category of people who already had 0s and thus couldn't improve from baseline to discharge because they already didn't have a concern for that particular item. So that's just something to keep in mind when you're looking at the data that I'm reporting here. On average, our young people, they entered the program with a CANS rating of 14.17 on the life functioning domain, and they left at 12.46. So we have, I think, pretty notable improvements. As I mentioned, we don't have this data yet year over year, so we can't look at what that progress is or has not been, but we're excited about these initial findings. That is what I have for you today. What I want to do is point you to our annual report. So this and many more data points are included in our annual report. So if you're a data nerd like me, you love data, please check it out and see some of the other findings that we've got for our program.
Lindsay, I have a question in the chat. If that's okay, Tasha, do you want me to handle that then? There's a question in the chat. There's 2 of them. I think one I'll give to you, Lindsay. Matt, see if the other one makes sense in terms of beds. So Lindsay, it says, is there information on whether CYMHTA is impacting the number of youth, high acuity youth, who are able to gain access to residential care? The second part of the question, which maybe Matt might be more for you or Lindsay, and is there improvement in the number of beds available to kids who are in this category?
I'll answer your first question, the first question read, Kelly. We don't have a way of tracking right now within CYMHTA if we've been able to increase access to residential care. What I will say is that we fund a wide variety of services. The bulk of the services that we do fund are community-based, but intensive community-based. And our clinical care coordinators are excellent at working with the families and providers to determine what is the best course of action for a young person. My favorite thing about this program is its flexibility. You'll see one of the slides I have details a variety of different services that CYMHTA funds. If a clinical case can be made for something, CYMHTA can fund it. I just love that about this program. It allows us to really meet families and young people where they're at and provide services from like respite, BMX biking respite, to in-home family therapy, to just a whole host of other things. So we don't have that data point, but I can say that we fund so many different types of services, including residential. And it's all tailored to what does that young person need in their family context.
And Lindsay, the second part was, and is there improvement in the number of beds available to kids who are in this category? Matt, is that something you want to take?
Yeah, I do. And so through our partnership with CDHS in the last 12 months, we have created 35 state-controlled high acuity beds, right? So these are state-controlled, meaning that nobody can say no, right? Like these are providers have already said no, are difficult to place, high acuity kiddos. So the state has 35 new beds contracted across 4 different providers at the QRTP PRTF level. So for those that are not familiar, that's okay. But for those that are, these are our high level residential mental health treatment beds. These kiddos, these 35 kiddos, otherwise would have probably had to go out of state. Right. So just knowing that our work with CDHS has worked to create new beds. I will also say around the piece of beds, please know we continue to have workforce issues, right? It is less about the number of beds and more around, do we have the correct workforce to fully staff a facility that might be licensed for 16 beds, but they only have staff for 10, right? That shows up on a lot of reports as we have 6 open beds. We do not, right? So I think I just want to throw that context in there. But we do have new beds this last year.
Great. I think Carolyn.
Hi. Yes, I just wanted to ask a question, because I think what frustrates me with the systems and the youth is that they have to be at risk or to the point of being incarcerated and under juvenile care, or either be taken out of the home. I mean, that's a past thing, it sounds like, but in order for the kiddo to get help, I mean, how is it that can a parent reach out in early intervention to be able to get the kids their needs met so that they're not using the gambit of the system, but actually are using less of the system in order to get the support that they need? And to me, that would be saving money, but also helping the kiddos in early intervention.
Thanks, Carolyn. Lindsay?
Yeah, I can speak to that, Carolyn. Thank you for that question. I'll say that's really what CYMHTA was created for. What you've described is the exact circumstance that CYMHTA is hoping to do. We want to help kids stay in their family homes, get the services they need, and not become multi-system involved. So that's the focus. What our definition, so we use a definition of at risk of out-of-home placement, very forward focused. So the question that our clinical care coordinators ask is, if this young person continues on the path that they're currently on in this family context, then will they eventually become more or multi-system involved or more involved in systems? And if the answer to that is yes, then we consider them to be at risk of out-of-home placement. And we're working to prevent access to these other systems as an avenue for accessing behavioral health. We want to work preventatively and help families get the support they need as early as possible so that we can keep kids in their families and help families thrive so that they're healthy places for all of the family members, including the young people. So that's the focus of CYMHTA. And if you are looking to send folks to CYMHTA, we have a website that provides explanation for how do you access the program. It's very simple. A parent or guardian has to call the liaison who represents their home region. So they contact our BASO liaison for CYMHTA. They call them, the BASO liaison picks up the phone and takes it from there. They're set up with one of our comprehensive standardized assessments. And then our staff work alongside the family to help this family get into the system, to the services that are clinically recommended through the assessment.
That's right. And in the slides that you were sent and were in the agenda, Lindsay's put in there the Family Systems Navigator and then the resources available. So Danielle and Tasha, help me with time. Happy to keep answering questions.
We are on a 2-minute before we have to move in, so we make sure that we have enough time for public comment and stuff like that. My question, I just want it on the record, but I'll let Danielle go first.
Thank you, Tasha. So I have a question about these contracted beds. Who ultimately controls those beds and the funding to them? I'm a little concerned as we're moving forward, as the Rays transition from 7 to 4, and Rays are also being forced to pick up placement from CPSs with those high acuity or complex kiddos. Who will have control of those beds? Because if we're asking people to merge responsibility of placing these kiddos who typically need these beds, will those beds move to whoever is the responsible party to be placing some of our most high acuity kids, to try and prevent that out of state placement? And then secondly, I know that we have 35 beds. In reality, we probably only have 15 beds because of staffing issues and things like that, or whatever is available. I'm just making up numbers. I see you saying no, Matt. I'm just, going from a conversation. Okay, so I'm trying to really understand who is the final say on these beds, because we regularly see CDHS say, we're done with this kid, they're too hard, and pull them from these contracted beds that are not supposed to be able to do that. And so I think there's a lot of confusion in local communities and among the Rays about these beds. And so I don't know. It would just be really great to have some very clear black and white understanding around that for all parties involved, because we are seeing different behaviors than what we're hearing in meetings on how this is supposed to work.
Yeah,
I'll see if I
Danielle,
can-
thank you for raising it. I know Matt can probably respond. I also want to be sensitive to the public comment timeframe. And so open to a suggestion to make sure we can respond, and happy to talk offline also.
I would love that.
I was gonna bring that up. Is there by any chance that Danielle would be okay with following up to answering the question on there? So we have time for public comment. And I'm just gonna put mine on the record right here. Is there any data between children and youth with the program that you're doing? Like what, because they're not being re-involved. I'm concerned to see where their transition is, if there's implementation into the child and youth detention centers, like what the data is that looks like on that. So if you can get back to me on that, that'd be great. And Danielle, and I appreciate your guys' presentation. This was amazing.
Thank you. Danielle, Matt, we'll get back to you, and Lindsay will follow up with you, Tasha, by email. Thank you all
guys so much. Thank you, Lindsay, for being here. On that note, we are at 10:26, which is 1 minute past our agenda schedule. And so I'm going to open it up for public comment. Caitlin, can you? Yeah, thank you.
So if any member of the public would like to come off mute at this time, you can either raise, I believe you can raise your virtual hand. If not, just type into the Q&A and I will ask to unmute you. All right, we got one hand raised. Megan Lovelace, I have asked to unmute you, so you should be getting a request to unmute yourself.
Hi there, can you hear me?
Yes.
Thank you so much for this great presentation and for the great work of this council. My name is Megan Lovelace, and I just wanted to raise up, and I do this a lot, but I'm going to raise it up here too, some of the other levers that I hope that interdepartmentally we are all looking at and utilizing when it comes to our youth. And so I do hope, in direct regards to CYMHTA, system of care, and children and youth behavioral health implementation plan. We're making sure that providers, parents, communities, and families know the additional resources around long-term service and supports, the youth buy-in program, as well as CDOS, other avenues to fund and resource families across the state to make sure that they in fact have access to the appropriate care in the appropriate place at the appropriate time. Thank you so much.
Thank you, Megan. That was a great question. And great information, because all of us, that's people of the public that have those issues, they struggle with that. So not knowing the resources on how to navigate that. So thank you for bringing that up. Answers, I guess. I don't know. I don't know how this works though.
Is there any other member of the public that would like to come up mute at this time? All right. Well, Tasha, I'm going to pass it back over to you to make our motions to close.
Hold on. There is something that just popped up in chat from Casey Smoot. Is there any advocacy work from BHA to improve staffing for the residential treatment beds you referred to earlier?
So what I can speak to is there is also in alignment with CDHS, BHA, our partners at HICPUF, and the Department of Public Health all contributed to a training academy content for all staff that work at residential treatment facilities. This training it will be required in the future. This is part of this work is through House Bill 241038. One of the components that BHA was working on and has completed is how do we make sure our staff in residential treatment facilities understand trauma, secondary trauma. Also, how do they understand culturally appropriate treatment for children and youth? So those are just two components, but really trying to support the current workforce that we have and ensure that we have good recruitment of workforce in those facilities.
Thank you so much for that.
Yeah.
If there's any more information or any questions that the public or anybody else has, please follow up. I believe there is a form on our public facing websites that you can access, and that will get you the answers to your questions that you're wanting. So I just want to put that resource out there for you guys, and for council members, everybody of Colorado. On that time, we are at 10:30, which is time. So I think it's going into debriefing. Correct, Caitlin?
So now it's just our motion to close out.
All right. So on that note, thank you for letting me be your chair today and filling in. Can I get a motion to adjourn meeting?
I make a motion that we adjourn the meeting at 10:31.
And can I get a second?
I second.
Thank you. So with that, meeting is adjourned. Thank you guys.
Thank you all for joining us today.
Guys.
I appreciate you.
I appreciate you guys and have a great week.
Bye, Tasha. Thank you.
Thank you guys. Have a great day.
You do the same.
Thanks, everybody.